directions, internal and external. They can use their other hand or use the wall of the door jamb. So I'm in good position. I'm going to resist going out into external rotation. I can resist going into internal rotation. So all the different motions of the shoulder, we can do isometrics, typically short lever arm and long lever arm. I have a quick little exercise routine that I'll have people do sometimes where they don't have to change positions, but I'll just have them make fists and they can push their fists into each other. Then I'll have them go on top and they're pushing into each other. On the bottom, they're pushing into each other. One on front, they push into each other, and then behind, they push into each other. And you get pretty much all the different directions by doing that. So sometimes patients will get confused and maybe I don't want them spinning in circles. Maybe they have a little vestibular issue and I don't really want them to be standing and pressing and tripping or anything like that. So I'll just draw them a little picture with fists. Just press in, press on top, press on bottom, press on front, press behind, hold each of those 5 seconds or so, and they can go through that a couple of times. All right, P and F, alternating isometrics by the PTA. So I had Brian down in position here in external rotation. We talked about alternating isometrics in flexion. You can do all the different directions. So kind. Thank you. So if we want to do, let's do flexion to start off with. So we talked about alternating isometrics. Brian's going to lock his shoulder in position. He's going to hold. Hear the Statue of Liberty on the wind. Don't let me move you. So we can come through and give little perturbations. And I say, hold it, come on, don't let me move you. Come on, hold it still, don't let me move you. Hold it still. I can mix up my directions. I can make it harder and have him close his eyes. I can mix up my timing and just have him hold. Typically, we're going to do this for a timed duration, 10 seconds, 20 seconds, 30 seconds. This will be strengthening in 90 degrees of flexion. If we want to strengthen in other degrees, we have to actually do this in other degrees. So I could have him come out of 90, have him hold the elbow still, but we're going to go a little bit higher than 90 and do the same thing. I can have him go a little bit lower than 90 and do the same thing. It's going to be easiest here at 90 because gravity is pulling straight down. He doesn't have to do as much work to hold it. It's going to be harder above and below or outside of 90. Okay, so by doing this, we're getting a co-contraction of all the rotator cuff muscles, all the stabilizers. We can also do in other motions, so I can have him here. So he's working more internal and external rotation. Same concept, I can have him at 90, then I can take him out of 90, either above or below, and hold those positions. And I'll just have him hold it still, don't let me move you. I'll come from different directions. I can have him close his eyes. We can progress it that way, have the patient have to hold for a longer duration while you're doing it, changing up your timing and your speed. Okay? So alternating isometrics. Thank you. And then band-resisted isometrics. So patients will get bored just doing isometrics. And if someone is, especially post-op, there may be 6 weeks when we can't do anything in a range of motion or active. It's only passive range of motion, and then you can start isometrics. And that gets so boring. And then jumping from isometrics into moving through a range of motion is a pretty big jump. So you can go in between. I learned this from a great local therapist. It's a band-resisted isometric. So I would put my loop in the door.
I'm intrigued.
Okay. So instead of pressing against the door and holding it, I can hold onto my band here. I'm locking my shoulder into position, and I can walk forward. I'm not doing any range of motion, but I'm progressively gaining more resistance as I walk forward, and then less resistance as I walk back. So I'm gradually pulling resistance on and off. But the joint is safe because I'm keeping it still. I'm not actually going through a range of motion, I'm holding it still. We can do it in a short lever arm as well, so I could hold here, and do the same thing. So I could do flexion. If I turn around backwards, I can do extension. So I have to pay attention to which direction my band is. So here's my extension. Again, I could do a short lever arm to start off with, so it's not quite as hard. I can do abduction, side step. And I could do abduction if I wanted to, typically don't. And then I can do internal and external. So if I'm standing with the band to my left, using my right shoulder and I'm stepping away, which muscles is this working? My external rotators. I'm holding them still. I'm trying to resist doing any bit of movement. So I'm working my external rotators there. If I turn around the other direction, locking everything into place, sidestepping away. Now my internal rotators are having to resist. So that's a nice intermediate step between just regular isometrics and doing a band exercise where you're going through a range of motion. So this is a safe progression that's not going to put the tissues in positions through a range of motion, or especially if they've been surgically repaired or there's a tear or something in there. It's a nice, easy transition into more progressive resisted exercises. All right, so those are all basic. Intermediate, so we can do the WIDIs or the I, T's, and Y's that we did last week. So those are scapular stabilization exercises to start off with. Then we can progressively add some weight. So we went through those last week. Shoulder and scapula very closely tied together. And especially as we get into these higher level exercises, you have to have scapular stabilization in order to perform them effectively without causing injury. Band resisted shoulder motions, all directions. So I did the stepping. We can do the bands for all of our different motions. So Brian had started us with some active and active assisted and passive exercises. So once your patient can do their motion, they can do it with the cane, they can do it actively, then we can add some flexion. They could just stand on the band, no problem. If this were a bilateral weakness issue, we could have them stand on the band and do both at the same time. Okay, most often I'd say we're looking at unilateral issues, so one side is effective. So I can do flexion, I can hook the band into the wall and do extension or do rows. I can hold on to the band or again put it in the doorway and then work on external rotation, turn around the other direction, work on internal rotation. When you do internal and external rotation, I would say more often than not, I put something between the patient's arm and their body, again to keep this slightly slacked position so they're not jamming straight into adduction, which isn't necessarily comfortable, but also to give them the cue that they are doing the pivoting or the rotating here in internal and external rotation and not lifting and abducting or bringing the arm back and forward. You'll see people go through these doing all kinds of interesting motions. So if you put something here, that's going to give them a cue. Keep your shoulder in position, keep a slight squeeze on that towel, because if they start to move their arm and get out of position, the towel is going to fall. So that's going to give them a good cue. It's a nice tactile cue that they can maintain. So with bands, how do we progress? Stronger band. Yeah, you can step away a little bit further, so tighten it up. Then you can double them, and you can also then go up in color. And it's a big graduation for a lot of patients. Oh, do I get to go to the red? Do I get to go to the red? Can I go to red? Can I go to red? Can I? Oh yay! Did I get to green? So it's pretty exciting for patients. So that is also a motivational factor when they can graduate to the next color of band. So we can do all the different directions. We can also do diagonals. So we had done with our scapular stabilization, we'd done our X's, so we could do the same thing. Working with the shoulder, we can also do, if we were standing, we're gonna go through PNF next week. I keep teasing you with PNF, but you can go through PNF diagonals, holding onto your band. So this way the direction of force is downward. If I wanted to go the other direction, I'd have to hook onto the wall or hook into a door jamb to go the opposite direction. So be aware of your gravity, be aware of where your resistive force is and the position. We're going to talk a little bit more about that in a few minutes, but realize that if you're using a band, your resistance is only going one direction. If you're doing active in a standing position, your resistance is only one direction. You could get somebody in the water now, and you're doing flexion and extension, and there's resistance each direction you go. There's resistance each direction you go. So be aware of what your environment is with these. Selectorized machines or cables. So I think probably all of you have been in a gym, worked out in a gym, or at least seen some gym equipment. If you stay up very late at night, you're going to see all kinds of interesting gym equipment these days. I'm waiting for my Brazilian butt lift. Yeah, interesting. I like fags, they're fun. So you can use the selectorized machines. All that means is you're putting a pin in a machine, adding more weight, so you can do things like chest presses, and you can do rows. There are lots of different shoulder machines where you can do flies, forwards and backwards. Be very, very careful with your form. Some of you may be in clinical sites or in jobs where your PT clinic is located directly in a health club, and you'll see all kinds of crazy form, and you're going to take your patients out and go, for that. I'm going to show you the right way that I want you to make sure your seat is positioned so you're in this position, so you're not in the chest press machine doing some weird position. I want to make sure you are stable through your scapula first before we add these extra items. So making sure people tend to want to increase their weight, and they want to show off, and they want to, they want to feel like they've done something, but sometimes you have to have 10 pounds on that machine and really focus in on your form, and that's going to do you much more good than trying to put 40 pounds on the machine and do this. So just watch your form, because our goal is rehab. We're trying to get someone strong and strengthened and balanced out because they've had an issue. It's not, I'm bodybuilding and I need to put certain force